people reflexively say, well, to do something like that, they must be out of their mind. And in one sense, that may be true, but that doesn't mean that they have a mental illness. To really understand it, you have to look at this phenomenon in the broader context. So, we have violence occurring in our society to varying degrees. Most of the crime is motivated by greed, passion, some particular purpose. The thing that's really gets the public attention now is these massacres that are occurring that make no sense. In this context, there seems to be an overrepresentation of perpetrators who do have some form of mental illness. Now, it's not all of them. So, for example, when Timothy McVeigh blew up the Oklahoma government building, he was doing it because of his misguided ideological zealotry, or when this Major Nadal Hassan at Fort Hood killed these people, was because of his rabid radical Islamic jihadist mentality. But then you have the Jared Loughner's and the Korean student at Virginia Tech. These people are clearly psychotic. They are not getting adequate treatment, and they do these things because their symptoms are impelling them to do it. There's also a third group of people that are involved in these tragic incidents. So you've got your ideologic zealots, you've got your untreated mentally ill, and then you have what's been referred to as the disaffected loner. So these are people who kind of exist at the margin of society. They've experienced slights and insults, all their life, and they build up this reservoir, and then one day they explode. So who are these disaffected loners? Is it something that's just a social phenomenon, or is there some kind of clinical, medical, psychiatric basis to it? I think that there's reason to suspect that there may be, in the sense that if you look at individuals like that, and we'll take the individual in Santa Barbara as an example, or maybe Adam Lanza or James Holmes, these are individuals that are intelligent. They don't have a learning disability, they don't have mental retardation, they don't have some kind of intellectual problem, but they have a social problem. And the term that, clinical term that one might use to describe it is called social apraxia. And so if you understand, as we do now in the context of modern cognitive neuroscience, that cognition is a very complex set of functions ranging from memory to attention to creativity to also how do you deal with the world socially? How do you go out, figure out what the pecking order is in your school? How do you understand how to find a romantic partner? How do you engage people and develop friendships? That's an intelligence. That's a form of cognitive of intelligence. And autism is finally understood to have as one of its features this kind of social disability. One of the features that we know in autism, and it's particularly the case in people that previously were called Asperger's syndrome, is they lack this kind of social intelligence. But beyond just autism, where this is one feature of, you also have another group of disorders which has in our society been pretty under-recognized, called learning disabilities. So we have dyslexia, we have various types of verbal learning disabilities. But what these are congenital, likely genetic, pediatric onset deficiencies in cognitive function. And this likely includes individuals that may lack this kind of social capacity. So there's a possibility that the individuals that have sort of been considered to be this disaffected loner type may be suffering from this type of social apraxia, which has been lumped into either the learning disability category or the high-functioning autism category.